5 minutes on behalf of his amendment.
Thank you, Mr. Chairman, and my colleague from Michigan. Maybe we can keep it that way, okay? The Democrat amendment nature of substitute, Mr. Chairman, amends the Employee Retirement Income Security Act, ERISA, to give the Department of Labor the authority to level civil monetary penalties against health insurers and plan sponsors for allegedly violating mental health parity requirements under the Mental Health Parity and Addiction Equity Act of 2008. This amendment strikes the mental health civil monetary penalties provision and replaces it with a provision that expands access to mental health care by allowing employers the option to offer standalone telemedicine plans to employees who do not qualify for their employer's full medical benefits. We hear regularly from stakeholders that the Department of Labor guidance on mental health parity requirements is confusing and subjective, creating a guessing game for insurers and plan sponsors. The Democrats' ANS seeks to punish employers who voluntarily offer mental health coverage to their employees, which does nothing to increase access for mental health care. It only encourages employers to drop mental health coverage. The committee should instead take steps to improve coverage for telepsychiatry through the expansion of standalone telehealth programs for employees. The standalone telehealth service program enables employees to connect with a mental health professional through a phone or video 24 hours a day, 7 days a week, including in times of mental health crisis. Department of Labor has temporarily allowed employers the option to offer this new health benefit to workers who are not eligible for full medical benefits, like seasonal and part-time workers, during the COVID-19 pandemic. However, this benefit expires when the public health crisis ends. This amendment removes the unnecessary and punitive penalties included in the ANS and cuts red tape by allowing employers the option to continue to offer their part-time and seasonal employees access to mental health care through a standalone telemedicine plan. If this committee truly cares, and I believe that we do, about increasing access to mental health care, then members should support this amendment. And with that, I yield back.
The gentleman's time has expired. Does anyone seek recognition on the amendment? Gentleman from Connecticut, Mr. Courtney.
Great. Thank you, Mr. Chairman. Mr. Chairman, I strongly oppose this amendment from my good friend from Michigan. And, I would just remind people, we're in National Recovery Month. In the midst of the COVID pandemic, the other epidemic that this country has been experiencing in terms of opioid addiction and overdose has been continuing actually at an even higher pace than the pandemic that for COVID-19. And, back pre-COVID, when there really was actually, I think, a pretty impressive bipartisan attempt to address opioid addiction, we passed the CARA Act. There was, in the last administration, a working group that came together to talk about ways that we could open access to people suffering from addiction to get care and treatment. One of the things that the Trump administration identified as a real weakness in the system was that ERISA plans were not providing people with consistent access to treatment, whether emergency treatment, follow-on treatment, telehealth, you name it. And the Trump Commission actually was the one who recommended putting in place monetary civil penalties to make sure that insurers followed both the spirit and the letter of the law for mental health parity, which again has been a knockdown, drag-out fight in this country for years, going back to Senator Paul Wellstone. And that lack of enforcement that the federal government has to go after insurers who are not complying with the law was identified by the last administration's working group as a reason why people were still struggling in terms of getting the help that they needed, and recommended putting in place the penalty structure, which is incorporated into this bill. And again, it uses existing language, which is on the books. When, again, on a bipartisan basis, We passed the Genetic Information Non-Discrimination Act a number of years ago, which basically said that insurance companies could not use genetic information, which is now available to insurance companies as a way of discriminating and imposing pre-existing conditions. We put in a penalty structure to make sure that insurers would actually comply with the law. I mean, there's an old legal adage, which no remedy, no right. And that's really what the underlying language in this bill is aimed at doing. And, I was out a couple of days ago meeting with folks who are in the recovery community and providers who, again, have been sort of marginalized or sidelined a little bit in the midst of the COVID pandemic. But they all came back really to a person saying that the access to care for people who are covered by Medicaid is actually far better and more consistent than people with private health insurance. Again, there are good insurers out there that really are providing people with the coverage that they pay for, but there are definitely some who are not. And that was something which, again, the last administration identified and came up with the very solution that we're incorporating into this bill. So I think, again, in the spirit of the bipartisanship efforts that took place in terms of dealing with opioid crisis, we should reject this amendment, leave that language in place. I agree with you, Tim, that telehealth has opened a whole new opportunity, which, again, private insurers have now participated in as part of the emergency regulations. That's something that we can work on separately, but we should not undermine the, I think, critical need for making sure that people who, again, are still struggling in the midst of COVID with addiction problems, and the numbers, again, are still gut-wrenching in terms of what we're seeing there, that the private coverage, which is a critical piece of making sure people get the help that they need, actually comes through as the law requires. And with that, I yield back.
Thank you, gentlemen's time has expired. Are there others that wish to speak to the amendment? If not, the question is on the amendment offered by the gentleman from Michigan, Mr. Walberg. Wait a
Mr.
minute,
Chairman, I withdraw my point of
Gentleman
order.
from Michigan withdraws his point of order. The question is on the amendment offered by the gentleman from Michigan, Mr. Walberg, on telehealth. All in favor of the amendment will say aye.
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 All opposed, say no.
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 No,
The noes appear to have it.
Mr. Chairman, I request a record roll call.
The gentleman from Michigan requests a roll call, and that